I'm Jeremy Fernandez. India is now in the grips of a crisis never before seen. On average, 4 people every second are being diagnosed with COVID-19 there. There are few other places anywhere else on the planet being hit harder right now. The country's 7-day case average is now above 341,000 infections each day. And every day, more than 2,000 people are dying from coronavirus. There are widespread concerns the actual numbers are far worse. It's now emerged that some states in India have run out of vaccines. Our South Asia correspondent James Oaten is in Delhi. James, what are the case numbers, the latest case numbers there?
Well, today's cases of more than 380,000 confirmed infections sets yet another record. The deaths today around 3,500, a little bit lower than yesterday, but of course these numbers should not be treated as absolute. Everything suggests India is still very much on an upward trajectory. One of the reasons why the numbers should not be treated as absolute is because the testing regime, for instance here in Delhi, has just been completely overwhelmed, and that's replicated in many of the big hotspot states and cities across India. Being such a big country, obviously the peaks will hit different cities and different regions at different times. But even if there's speculation like Delhi might be somewhere near the peak, one of the issues is that hospitals are saying that the severely ill patients now they're dealing with are much worse off than they were last year. So they're filling up the hospitals for longer. It's usually about, between a week to 2 weeks before, I guess, the severe deadly symptoms really show themselves. And so what you're going to see is a death rate that will lag behind the confirmed infection. So even if Delhi is hypothetically somewhere around the peak, the deaths are expected to continue to go up in a city like this. The vaccines, of course, that's where all the hope now lies, and India's vaccine program has always been underperforming. Yes, they are getting big numbers, but they need even bigger numbers to achieve their targets. And there's been a shortage for several weeks and months now, in fact. And from tomorrow, all adults were meant to be eligible to get the jab. At the moment, it's only open to 45 people aged 45 and over. But you've got states like Delhi and Maharashtra and Punjab saying they've run out of vaccines. So it looks likely that the next phase won't begin on time for several big states as well. So at a time when people are really looking for some optimism, it's pretty hard to find it at the moment, Jeremy.
James Oaten in Delhi. Thank you, James. Well, India and Australia have some deep diplomatic and people-to-people links to this crisis, hitting home to a lot of Australians. Pavan Luthra is a respected member of the Indian community in Sydney and the founder of the community news outlet Indian Link. Also with us is Ani Jetty, one of the many Australian citizens who've been trying for months to return from India. Welcome to both of you. Ani Jetty, let's begin with you. Tell me what it's like there for you right now, especially as an Australian citizen trying to get home.
People are trying very hard to get back home, especially at this time. It's really, really hard to get back home because of the suspension of the flights at the moment until May 15. That is what the Prime Minister told. But I don't know what they're going to do later on. It's like a ticking clock for us. We are just putting our fingers crossed to listen some sort of good news, at least for the permanent residents and the citizens of Australia. They really need to get back home at this point of time because it's the death rates and the infection rates are going up every single day. So I'm just hoping for the best for all of us to get back home as soon as possible.
Do you feel safe there?
No, not at all at the moment. I'm staying at home. I'm trying all the safety measures at the moment, taking medications. But still, I'm scared. You never know what's going to happen next. You're getting infected, you're not getting infected. But the vaccinations are in place. My parents just got their shots done this morning. So the program is still on, the vaccinations program. So I think hopefully the day is going to get better. But at the moment, no, we just wanted to get back home where we feel safe. That's our home. We have this right to get back home.
And home is Dandenong in Melbourne for you. Pavan Luthra, can I just ask you, this is the sort of story we're hearing from dozens and dozens of Australian citizens who are stranded in India. How is it that 1 year into this pandemic, we're still seeing people trying to get home?
Jeremy, it was about 13 months ago when the government announced their travel bans. Now, since then, the way we travel has changed. Prior to that, we could get online, find a destination, find the best deal, grab our passports, and then leave. Now there are restrictions not only as to when and how we can leave Australia, but also in the countries where we are arriving as to what the restrictions over there are. So it's been a totally changed ball game. Now, Australians who did go to India were there for a number of reasons. Some of them were there for business, some of them were there for studying, and some of them were there for visiting family and friends, everything which a vibrant, multicultural country does. Their citizens travel globally in a safe and a secure environment. But then March 2020 changed everything. Now, since then, once the travel bans were announced, the number of flights dropped substantially. So obviously there was no normal traffic of planes flying between India and Australia from either Doha or Singapore or wherever they're coming from. Therefore, there was total uncertainty for the Australians stuck in India as to what should they do. A number of times, these flights were announced at total random. There was just an announcement saying there's a plane going to Australia. I'm aware of a number of my friends who spend their days and nights just sitting by the computer, randomly searching, hoping to be in the first 3 minutes to 5 minutes because these flights were getting booked out in that quicker time. And the worst still were that as the travel restrictions were introduced more rigorously, a number of these flights were getting cancelled. Again, there's a family of 4, which I'm aware of, who had their flight cancelled twice. So they spent about $10,000 for the family each time, and it was only in their third attempt were they successful in getting back to Australia. And they lost their $20,000 because there was no way they could get a refund. The airline refused to honor that commitment. I think the people of Australian origin who are stuck in India are there because it's just a state of affairs rather than wanting to be in India.
Ani Jetty, you're one of these people who's stuck there. What is it like for you looking back at Australia and the government policies there to put this temporary flight ban on? And it's a decision that's got a lot of support from the community, saying that the borders should be closed given the scale of the outbreak in India. What is that like for you, knowing how much you're struggling to get back home?
People they don't know what's going on. They just pass on the comments. Like, I've seen after a few interviews of my friends who have given, and the comments were so horrible, and I was so upset. Like, how come so much of hatred? They just say that I can see few comments saying like, stay where you are. You have opted for that. You stay where you are. You don't belong here. I felt very unwanted. I have taken an oath as an Australian citizen. And why so much of hatred? If you don't have much good to say, just don't say bad as well. Just keep words to yourself. And it's government who's going to take care of us. So it's nothing like, we are just hoping to get back home. We thought like there is some sort of mateship while I was taking oath, me, my husband. And when we see these negative comments, we just laugh over it. And why so much hatred in this world? People need to. It's not easy, while in pandemic especially.
To add insult to injury, I know your husband recently lost his job in Melbourne, and while you've been away, your home was broken into and ransacked. How are you surviving right now, day to day?
Oh yeah, it's been several times the burglary happened. First time was last year, July, if I'm not wrong, and then it's recently in April. I was supposed to travel on the same day while I was in Chennai to give my COVID test, and we thought, okay, we were consoling ourselves like, okay, after 14 days we are going home, but unfortunately my results have come back saying it's positive, so I have to stay back, all 3 of us, me, my husband, and a 6-year-old boy, my little son. So I don't know. People just, the police say there are squatters living at home. I'm so scared to get back. I just wanted to get back home, like what's going like what's going on. We have invested so much. It's a hard work that we have invested there. I just came to Australia as a student and then slowly made up my life. Then I've become citizen and I feel that's my second home. And finally, this is what's happening, especially during this pandemic. We are, as it is, we are stressed out. And financially, it's my parents, my in-laws who are absolutely helping us out at this time. And I'm so grateful. I'm at least getting some sort of help.
Pavan, can I come to you? These are more than just statistics. I mean, you hear these appeals and yet at the moment there's very little room for people like Ani to move. You're in touch with friends in India, friends and family in India who are directly affected by this crisis. What are they telling you about the most urgent need there right now?
Well, obviously the medical supplies are in a very short quantity over there. I get up every morning to 200 to 300 WhatsApp messages, and the majority of them are saying that, do you know anybody who can get us get us into a hospital, can get us into an ICU unit, and more importantly, where can I source an oxygen cylinder from? Because I'm afraid that if something happens to me and my family, we need oxygen, and India is gasping for air. There is no oxygen around there. Oxygen is the new currency in India at the moment. So that's one of the messages which I'm getting. The other one is even more somber. The belief is that we will test positive. It's not a matter of if, but it's a matter of when will we test positive. And they're desperately hoping the situation at the ground level in India improves substantially before there is any adverse effect to themselves individually.
Pavan, what's your reading on the impact this sort of crisis has on Indians in India, the diaspora around the world? Something on such an enormous scale would be very difficult to recover from, wouldn't it?
Correct. I would say one of the things is that long-term effects of those testing positive or experiencing COVID are not yet proven. So we don't know what effects will it have on their lungs in the long term or any other physical being. The mental pressures and the mental issues on this are going to be substantial because people, both in India, globally, everyone is seeing people dying on the streets. The images of the funeral pyres on a makeshift rooftop. This is going to be etched in our memories for a long time, and there will be substantial mental health issues. From a financial point of view, I believe that it could well derail the world economy. India is the 5th biggest economy in the world, and it's coming to a shuddering standstill. Issues like India is the 3rd largest pharma manufacturing country in the world, supplying most of the world. So if their capacity gets diverted to vaccines and other medical requirements for the Indians themselves, that's going to have a global impact. Also, the back room, the call centers of a lot of multinationals are in India itself. Now, the multinationals do it so that they can drive their costs down and keep their profits up. And this can impact even things like our superannuation returns in Australia, because if India cannot handle these functions, chances are that the cost will go up, the profits will come down, which in turn will flow through to the returns from our superannuation funds. So what we need to understand is that we are connected globally on what's happening to India, and we need to do everything we can, stand by India at a time like this.
Ani Jetty, a final word from you. Do you see hope on the horizon from where you're sitting right now?
Yeah, I definitely feel I can see the hope because the Prime Minister was saying like several flights would be in flying back like in several days. I don't know how several it is, like how many days it would take, but I still see the hope, like we will be going back and the vulnerables would be fled back soon, yes.
Ani Jetty, Pavan Luthra, great to have you both on the program. Thank you so much for joining us.
Thank you.
Thank you.
And that is the show for this week. Join us every Friday at this time or any time on iView. From all of us, bye for now.